Got it. The most important part is to record this. Maybe. I doubt it. It's from my.
No, they can't because the mic is recording.
I mean, like, it's just from my computer.
Oh, but they sit here.
Why? Why are you so shy? Don't be shy. This is the place where you get humbled and embarrassed so that you don't make a mistake on the exam, all right? Okay. So this is.
Shit. No, you don't have to.
Right. Everyone connected for the Slido? Yeah? All right. $24. Yeah. Okay. Let's see. It is active. Yeah. You can put an answer. Okay. I don't think I'm sharing my screen. Hold on. Sorry. I'm not sharing my screen.
Yes.
Let's see. There we go.
Double the area of the membrane that on the inside or outside. Honestly, it's wrong. Like a cold drink. Yeah, it's like a cold drink in our heads. We're like watching all the documents. It's like.
When's the final exam for this course? Final. You guys don't know? Oh, that's bad. You don't know when your finals are. April 18th. Okay. I will.
Tuesday.
It's a Tuesday.
Yeah.
Well, it looks like both your exams for this course are on Tuesday. Okay, so yikes, genetics is on the 19th. It sucks.
And then bio.
Wait, Bio 201? When is that?
27.
Oh, no, that's like you have. Oh. Yikes. Okay, 8. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Come on.
Oh.
9. Okay, it's fine. It's fine. Let's see. Lock voting. Show correct answer. Oh, show results. Interesting.
Oh, area of cell membrane and not inside because cell membrane
So let's see. Let me see what I can do here. Just give me a second. I'm trying to find something here. Midterm review.
Because
Okay.
I just read.
So share content. Let's see if I share my screen. I hope this doesn't mess things up. So it would be nice to be able to, yeah. Yeah, it's just no, I didn't provide a Zoom link because it's kind of useless. It's a lot more work. Okay, so you know the flow. Can you see this? Can people on? I want to see. Yeah, on Zoom they can see it too. That's the most important part. Okay. D times C out minus C in. Yeah, I'm writing, but it's yeah, so you can see it. You can see it here, right? So if we go to the Slido, where's the Slido? Doubling the concentration of oxygen just outside the cell membrane, that would be doubling this, but that doesn't necessarily double this entire term, right? Oh, let's see. There we go. So that would be doubling this, but that doesn't necessarily double that entire term, right? So that's a trap you got to watch out for. I'm unmuted. Okay, perfect. Yeah, and there's a bunch of other things. There are a lot of different options, you know, like if this was cut in half, then that would double it as well. This is the correct answer choice that was given in that question. And if you double this as well, then the flow would double. All right, so just keep that in mind. I'll stop sharing here. Let's see, share here. All right. Okay. List of poll questions.
Are you sure? I agree. I was there.
Hey Phil, how are you? Not bad. Okay, we have 9 people. That's enough. Okay, let's see. Yeah, all right. This is just from the same equation, all right? And it's the concentration difference, right? So it's C out minus C in. It's that entire term that's being halved, all right? Having the thickness of the membrane, that would actually double it. Having the concentration of oxygen just outside the cell membrane, that would decrease it. It wouldn't necessarily have it. And then the other 2 options, they weren't chosen. Okay, next question. Let's see. So, I mean, notice the language in these questions, all right? So you have to pay attention to that in your exam. If it says increase, or if it says double, or if it says half, or if it says decrease, all right? So something might increase it, but it might not double it. Something might decrease it, but it might not have it. So pay attention. Because they'll get you. They got me. I'm letting you know. All right, 11 people. Maybe one more. Nah. Oh, 13. Perfect. Actually, I don't like that number, but it's fine. 13? No, man. I mean, like, I'm a little stitious. I'm not superstitious. I'm just a little stitious. And 14. Perfect. All right. There we go. Lock voting, show results. Great. Good job. Good job, guys. All right. Yeah, yeah. All right, let's move on. So these are all you can see these from, like, if you know the equation on the exam, you just write this down on your paper and then you just like look at one by one. Easy point. You know, you're just like, oh, thank you, Dr. Guevara. All right. Let's see. This is too high up, this chair. I'm gonna be well said, yeah. I am too tall. We're gonna be sitting for an hour and a half. Might as well be comfortable. Okay. 13 again. Okay, no worries. It's fine. Block voting, show results. All right. Now let's see. What's the relationship between flux and flow? Relationship between flux and flow. Yes? Flux is flow over area. Therefore, if you look at the equation for flow, so it's the diffusion coefficient times the concentration gradient times area, that's flow. You want to find flux, you divide by area. So you're going to see the flux is actually independent of area. Even though it says flux is flow over area, you say, oh, okay. So flux is flow over area. Then it's going to be the diffusion coefficient times the concentration gradient. So area really doesn't play a role here, right? And increasing the concentration of oxygen just inside the cell membrane, that's going to make the numerator of the concentration gradient term smaller. And so that's going to decrease the flux, right? Would you guys like me to show that, or we don't need that? Show it? Okay. Let's see. Really testing my technological adaptability here. Okay, gotta go to the Zoom. Share screen. Start broadcast. Okay. I don't want to stop the share here. Why isn't it start broadcast? Let's see. Okay. Yes. So decrease the flux of oxygen. Flow equals, so we have D times C outside minus C inside divided by thickness of membrane times area. Flow, yikes. Flux equals flow over area. So it just equals D times C out minus C in over D. Now, how can I decrease this? How can I decrease the flux? I can decrease the flux by decreasing the diffusion coefficient, diffusion constant. So this option has increasing the diffusion constant. No. Decreasing the thickness of the membrane. Numerator becomes smaller, then flux will increase. No. Decreasing the area of the cell membrane. Well, I don't really see area of the cell membrane being a part of flux here, right? No. I mean, it is here, but it's not here, right? Increasing the concentration of oxygen just inside the cell membrane. If I increase this, then this term becomes smaller because it's being subtracted. So that'll work. Yes, and just for completion's sake, increasing the concentration of oxygen just outside the cell membrane. So I'm increasing this term and saying that this stays constant. It's going to make the numerator bigger, it's going to make the flux bigger, but we want to decrease it. So this one is also no. That's for doubling and halving. But in general, like, because when I say increasing the concentration of oxygen just inside, it's only this. It's assuming that this one stays the same. All right. So does that help? Or right. So let's say if I wanted to double, let's say this is 20. And let's say this is 20 here. 20. Let's say this is 20. Let's say this is 10. Let's say this is 10. Let's say this is 10. All right. Now let's say if I change this, if I have this, it's going to be 5, right? So let's make this into 5. So it becomes 20 and then 20 minus 5, so 15 over 10 times 10. But now let's compare that to if it was 20 and then this was still 10. It's going to be 10 over 10 times 10. So what do we get? The 20s cancel out, the 10s cancel out. This 10 cancels with this 10, and we get 15 over 10, 1.5. So even though we halved it, it didn't necessarily double, right? That's what I was trying to get at. Yeah, okay. Perfect. Stop here, and let's move on. Okay. Right. 12 is good enough. Very good. Flow of a substance across a membrane is directly proportional to its concentration gradient. Good. So if I said concentration difference, you know what? Let's not even get into it. Actually, that is true as well. All right. Would it be?
Just the C out minus the N.
Mhm.
But country period is over this. Right, so that would be different. Oh, no, it's not. It's not great. This is the other day. But then it's like, this is like from before where we have to consider the entire thing as a factor versus like only the top numerator, right?
So exactly. So constant. So if I were to say the flow of a substance across the membrane is directly proportional to its concentration difference, that would also be true. It would also be true because say if I have the concentration difference, I will also have the flow. If I double the concentration difference, I'll also double the flow. However, if I have or double one of the terms in that concentration difference, and keep the other one constant, it won't be directly proportional, right? So it's kind of these nuances that you have to keep in mind during the exam. So I highly suggest you know that formula well, okay? Because you might get a question on it. If you do, then it's going to be very easy. You're just going to look, you're going to look at the terms, you're going to remember this review session, you'll be like, oh man, I love you, Shar. And then you're going to get the question right, and you're going to be happy, and you're going to be in medical school, all right? So, all right. Now, this is miscellaneous, the category of this question. I really hope you don't get a question like this on the exam, but I just have to keep you on your toes, okay? I should have capitalized that, the false part. Yeah. See, oh man, they'll get you. They'll get you on that. Yeah, you really got to be careful, okay? The does not or is true.
He said if he didn't choose cardiovascular physiology, he would have been a comparative cardiovascular physiologist.
It's pretty cool.
So there's gonna be questions.
I there wasn't on my midterm. So that means that maybe there might be on your midterm. Okay, 10's enough. All right. Luck. Because I know, oh, see, I say 10's enough and y'all are rushing to answer before I show results. Show correct answer. Yeah. So these are all wrong. I don't want to go into this because I really don't want to, be wrong, but I don't think this will be a question on your exam. I just wanna give you an idea of like the kind of the way they might ask a question, right? Just giving you a general way, like idea of how they might ask a question. There are much more important things in the cardiovascular section that they'll focus on. But this, you can find the answer by just looking through the slides, all right? So next up, math. And so the 3 here means cubed. Could have written milliliters per second instead. Oh, yikes. Okay, let's see. Don't want to show you guys. Now I'll just say that this was a question last year, right? But I wouldn't count on it being a question this year. Omar, how was genetics for you? You thought it was long. It was a really short exam, man. An hour and a half has never gone by quicker for me. Just wrote straight for an hour and a half. And like pencils down. It's like,
Yeah, it was like that was long for the time.
yeah. Exam was long. It's fine. Maybe the curve.
For me, last year were 7 questions. I mean, last year were 6 and this year was 7. So maybe we'll just drop. Hopefully.
I hope so. Yeah. Barely, but I don't know. Like you like even if you write something down for every question, like what's the quality? Is it good quality or not? All right, 9. Okay, for this question, 9 is good enough. Lock, show results. Well done. Okay. Would anyone? Yes, you'd like to. You like me? Would anyone like to explain? You want to explain? You want to hop on the chalkboard and explain? See, now everyone watching the recordings would be like, ah, damn, he won't show us how to solve this one because she's doing it on the chalkboard. Don't worry, guys. I'll whip it out on the iPad too. A lot of pressure, Brianna.
Why? If I get it wrong.
Flow equals rate times area. Okay. The rate is 20 centimeters per second. Area is pi r squared. Exactly, perfect. It is the lumen area. Very good. All right. I will just for the sake of everyone watching this over reading week, by the way, I hope you're having a good break. Yeah, what break? That's facts. I'll share. I'm sharing my screen. Okay. Let's see. Yeah. So yeah, flow. You can write flow as area times velocity. I will show you, if you have, this is your blood vessel, you have blood moving at a velocity v over an area, this being your area. All right, so in essence, you're just calculating the volume of the cylinder. And also my handwriting usually isn't this bad. It's just that because I'm going fast for the sake of time. All right, so now we need the area of that. The area is given by here. Area is pi r squared. So pi, and it gives us the diameter, d over 2 squared. So it equals pi d squared over 4. And the velocity, v, is 20. So what we have is the flow equals 20 times pi d squared over 4, 5 pi d squared. So let's see, 5 times 3.14 times, if it's 4 millimeters, then it's, let's see, it would be 0.002. No, that's meters. Yeah. Hold on. This is why you need your units, all right? So this many centimeters per second. So then 0.0, hold on. Oh my goodness. I'm blanking. 4 millimeters is 0.4 centimeters. And so, there we go, 0.4 centimeters squared. Yes? Pi d squared. Okay. And you do this, you should get this answer choice here. Does that works, yeah? Okay. That's what you did, Omar? Okay, perfect. Let's see. You got it already? What are you doing for the break? We're studying just Fiji 210. Anything else? Oof. How was that class? Why'd you take that one instead of Bioxy 12? Got him.
The week after, I think it's Tuesday. The 40th.
Man. Don't worry, it gets worse than you too. All right. It gets worse. Oh, it gets worse. Well, you're in pharmacology, yeah? No, yeah, pharmacology is, I think gets better for pharmacology. Gets worse for physiology. How about for MIM? Yeah. The MIM in your U2 year, especially in the fall, is pretty brutal. Bioc 311, 323, 324. And then the 384 lab.
Yeah, but ours was easier last year. We had half of the period.
Yeah. Yeah. Oh, we have 11. Okay. Very good. Okay. So capillaries are very short. That's 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 what you need to know. So a capillary being longer than a vein, that is false, right? So and then these other ones, they are correct. They're true. The total number of capillaries is greater than the total number of venules. That is true. I mean, all of these are true. I don't have to go over them. Just I believe they're in your slides. They have all the information on that. So you got to kind of yes. The total cross-sectional area of all the veins is smaller than the total cross-sectional area of all the venules. So it's kind of like if I have a big ice block, that has a surface area, right? And as I make it smaller and smaller and smaller and smaller, the surface area increases. So that's kind of what's going on. Let's see if I think I have the slide here. Let's stop. So like it's branching out more. And so yeah, there's so many more branches. I'm not sure if we went over this in lecture. Let's see. Share screen. Right here. Let's see. Vein venule total area. You can see venules have greater area than veins. All right, we're good. Did you guys go over this in class? Okay. Okay. On to the next. No, I don't want to go to my MCAT stuff. Not yet, at least. All right. Share. All right. Next question. This one should be quick, I think. So you remember when Dr. Guevara said like the bonehead questions, right? Like he'll have like if he has 10 questions, 8 of them will be bonehead questions. Bonehead, like it's like yeah, like your brain can be mostly bone. Yeah. Yeah. So this is like an example of what you might get. There are going to be a few questions where you have to kind of think your way through it. I don't have any of those because they're difficult to make. I mean, just look at you can look at my tab right here up here if I can move this. over. This is Bioc 312, genetics. This is Bio 301. It's nice. It's great. Find a nice partner. And, you know, a partner you can be homies with. I've heard horror stories about partners.
So you get one partner and then for the rest of the
Yeah, you pick a partner. So, like, I don't know, if you like working with Brianna, then you guys can choose a day together and make sure your partner is on that day. I'm talking about a future course. Yeah. No, but it's a lot of fun. So, like, if you have a good partner and Mhm.
Yeah.
Then this is MIM 314. This is Math 324. And this is my French class. And then this is just PHGY 210, which I'm not taking. Oh, 13. Okay. Lock, show. All right. So, yeah. All arteries, they're, I think, distribution, I believe. That's what it's called, that class. Yeah. Yeah. So, because I mean, you have the large arteries, and those are distribution, yes. So that's why you have to be very careful about stuff like that. How about you? You're in genetics, PHGY 210, Farm 201. Let's see, the lab 213. You got one more, Bio 201.
also put with
Oh, Chemo Food? Oh, Chemo Food. I'm thinking about taking that next year as like a little treat, you know, a little bird course. No, but you're gonna have to take Farm 300. Yeah, study hard for that one. And like, if I think it's gonna be recorded. Make sure you watch the recordings and like very detailed, like transcribe it basically. All right, 10. Once we get to 10, I'm just gonna stop it. So lock, show. All right, so this is true. That is true. Question wants it. When it's false, let's see. CVP is approximately the same as right atrial pressure. That's true as well. These are all true. This one is, see this one, because it says left atrium, we actually want right atrium here. That's why it's false. That's why this one is correct. You have a question? Okay. All right. And yeah, I mean, please stop me if there's something you don't understand, and I'll try my best to answer it. Yes. Explain. Oh, Dr. White? Like on which part? Oh, on the graphs. Like the graphs that it showed. Yeah, it could be. I don't think it's a question on the quiz. From what I remember, I don't think his research would be a question on the quiz because his research isn't in the textbook. It might be, but like it would be basic stuff. Like which of the following I'm just thinking off the top of my head here. Like which of the following is true regarding vitamin D and like regarding vitamin D? And it'd be like vitamin D expression isn't like vitamin D, the enzyme encoding for vitamin D. Oh my goodness, I ruined it. The enzyme that catalyzes the synthesis of the active form of vitamin D is upregulated after infection, like something like that, maybe. Or that. Yeah, I don't think he asked about his research. Mm-hmm. I doubt it. I doubt it. It's more about like Cushing's, Addison's, thyroid hormone. Yeah. We'll get into the questions. Okay, 15. Sorry. Luck show. Very good. All right. Velocity is the fastest in the middle, and all right, we'll move on because these are 0. Well, so it's laminar, right? It's laminar flow. So you got to think of the thing he did with his umbrella. You guys remember that? Yes, no. So it's because like the blood at the edge of the vessel, it's kind of there's friction, like he talked about the friction at the edge of the blood vessel as the fluid's moving against the endothelial cells. There's always friction. It's kind of slowing it down at the edge, but in the middle, there's nothing stopping it. So that's why it's faster in the middle. That's one way you could think of it. All right. So let's see. 30 questions. Dr. Guevara gave 10 lectures. Expect, let's see, and Dr. White gave 5, Dr. Lalong gave 7. So 30 over 22, like maybe 10, more than 10. 10 is about half of 22. Maybe 15 questions, 14 questions. Maybe a bit less, maybe 10. And then let's say 11 to 13. And Dr. White might have 6 or 7. Dr. Lozon will have the rest. That'd be, not sure. Yeah, like okay. I'd expect 14 questions for Dr. Guevara. Then 7 or 8 for Dr. White, and 7 or 8 for Dr. Lozon. Maybe a few less for Dr. White, like 6, and then 10 for Dr. Lozon. All right. Very good. All right. The combined resistance of blood vessels in parallel is greater than the resistance through each individual vessel. Not quite. It's less. If you think of your physics, when you had resistors in parallel, the equivalent resistance was always less than either resistor itself. So just keep that in mind. I do remember there being a question about that on the midterm. So the series and the parallel, right? So I would brush up on that. All right, 10. Block, show. Very good. So it's actually the pulmonary and atrioventricular valves that are the semi-lunar, I believe. And this one is their 4 pulmonary veins, right? Oh, actually, sorry. So mitral and tricuspid, these are the atrioventricular valves, not the semi-lunar, right? And so for this question, there's a million different ways they can ask it. So you really kind of do have to know the anatomy of the heart. Like if you think of, there's a lot of different ways you can ask this question. And same with the Wiggers diagram. You remember that? The wig, it's called Wiggers. It's with like the four like the ejection phase, the lub dub. Yeah, there's a million different ways. So you have to kind of be able to draw it, honestly. Yeah. Yeah. All right. Question 14. Like you have to know when the lub happens, the lub dub, what's happening during then, the T wave, QRS complex, when that exactly happens, during which phase, the pressures. Right. Very good. It is the SA node. And immediately after the activation of the AV node, the action potential propagates through the bundle of His. All right. Then it's the left and right bundle branches. All right. So that's the immediately after part that I was trying to get you with. Okay, but yeah, from top to bottom and left to right. I think you guys talked about this in the PHGY 213 lab. Yes. Anyone want to explain?
When you're looking at someone, you're seeing your right side is their left side. That's why it's going from their left.
And so the question is not to be able to on our
Mhm.
it's because it's like the right bundle branch is not myelinated, it's not like flapped up. And so the action potential comes out of that one, but the left one is
It's yeah, so well done. Yeah, it's insulated. It's very nicely. Okay, so let's see. It's the left bundle branch, I believe, that's not as insulated, and so the action potential can spread out through the muscle. Mhm. Yeah, exactly, with your hand. So for those watching the recording, I believe it's maybe lecture 5, the 5th lecture, or the 4th lecture that Dr. Govar goes over this one. It's very important to know. So keep an eye out for that. All right. This one was also on the midterm. Not exactly word for word, but something of the sorts. Once you, yeah, I did it. I despised it as well. But once you get it down, like it makes sense. Yes. Okay. Mm-hmm. I'm just gonna pull it up here so that I don't lose it here. Let's see. So for option D, so this one's wrong. This one's wrong because it has to go through bundle of His first. So it's not immediately after. Like, sure, the action potential will propagate into the right and left, but it's not immediately after the AV node. It goes SA, propagates, activates AV, propagates to bundle of His, right and left bundle branches. Then you have depolarization of the muscle. Mm-hmm. Yes. Yes.
Okay, so it's not the cell itself. How do you impact?
Yeah, so it would be the local circuit currents, and so it's looking at the currents moving through the gap junctions, the connexons at the intercalated disc. I just said a lot of big words there, but yeah, you gotta know those. Yeah, so you got one cardiac cell intercalated disc, another cardiac cells, looking at how the ions are moving in those cases. One more. Bring it up to double digits. You would like me to go over this whole thing. Oof. Okay. Say no more, dog. All right. Lock. Show results. Oh boy. The correct answer. Okay. Oh man. This one is important, I'd say. So I'm just gonna give me a second. I need to get the slide. See, Dr. Gabar expressed his disagreements in having undergrad team mentors because I've only had about 10 lectures of cardiovascular before you guys. So I'm not necessarily fit to explain at a post-secondary level caliber about how this works, but I'll do my best. Just give me a second. It's just collaborative, right? Just several peers working together, figuring things out. All right, electrophysiology. All right, copy, done. Let's see. Paste page. Okay. Go to the Zoom. Share. Start. Yes. Share the screen. Right. And just gonna make this small here so I can pull up the Slido to look at the answer options. So you guys can see what I'm writing. No. Ugh, that's frustrating. I made it for endo too, but I don't have any respiration. So I'm sorry about that. Okay. So let's see. Which of the following examples is correct regarding local circuit current flow from an activated cell to a cell at rest? So we're actually looking at this situation, all right? Sodium ions on the intracellular side of the resting cell flow through gap junctions toward the intracellular side of the activated membrane. Is that the case? No. So, okay, the resting membrane potential, you know, that's usually around minus 70 millivolts, okay? And so that means, I mean, you do have sodium inside there in the cell at rest, of course. But, you know, we want this action potential to propagate. So that means this cell wants to depolarize. That means you want more positive charge going inside of it. Therefore, you don't want sodium ions that are here, the Na plus inside here, going back into the cell that's already been activated. That's why that first option choice is wrong. Rather, you'd want sodium on the intracellular side of this activated cell to go through there. So you see, potassium, sodium can also go through, okay? But it's potassium in the cell that's much more abundant than sodium, which is being shown here, okay? But there is obviously sodium inside here too that can move. And there's sodium inside here that would not want to move in this case. Okay, next option. Sodium plus ions on the extracellular side of the activated cell membrane flow towards the extracellular side of the resting cell membrane. Well, just from this slide, not quite, right? So it's actually the extracellular side of the resting cell. So let's see, why is this wrong? Sodium ions on the extracellular side. So if I want to depolarize this cell, that means I want as much negative charge outside here and as much positive charge inside here as possible. That makes the membrane potential positive here, because it's the potential in here, voltage in here, minus the voltage in here. So if I have a plus minus a minus, it's going to give me a really big plus. That's what we want. Does that make sense? Okay, I see some nodding. Please stop me if that doesn't make sense, okay? So if I have sodium, so in this question, saying Na plus ions on the extracellular side of the activated cell membrane flow towards the extracellular side of the resting membrane, that means sodium's coming here. So it's making this negative over here, it's making it less strong. All right, it's decreasing the magnitude of the difference. So it's not depolarizing as much. It would be the opposite of depolarizing, because then you won't have more positive on the inside and less positive on the outside. Does that kind of make sense? Yes? No? Okay. Okay. Calcium ions on the intracellular side of the activated cell flow through gap junctions toward the intracellular side. So in this case, you can think of calcium synonymous to potassium in a way, right? You just generally think of them as positive charge. And so you want to activate this resting cell. That means you want to depolarize it. That means you want positive charge flowing in. In this case, option C, calcium ions on the intracellular side, moving of the activated cell, moving into the resting cell. That's exactly what's happening, right? That's going to depolarize the cell. Next up, let's see. I have to pull this up a bit. So the way it works with positive charge, I mean, it kind of works, it does work the same with negative charge, just in the opposite manner. So let's just, for completion's sake, let's get it done. Chloride ions on the intracellular side of the activated cell membrane flow through gap junctions towards the intracellular side of the resting cell membrane. So it's saying that we have negative charge in here, and that this negative charge is going into this cell here. Well, if you want to activate this cell, you want positive charge going in, all right? You don't want any negative charge moving into this resting cell, because that neutralizes any positive charge that might be inside here. So that's why that's incorrect, all right? Then chloride ions on the extracellular side of the resting cell membrane flow towards the extracellular side of the activated cell membrane. What this is saying that if we have any minus charge here, that this minus charge is going to move over to here. We don't want that, because then you have less minus charge here. And so when you have all this positive charge in here, the membrane potential isn't as strong, right? Again, so when I say it's positive charge minus, so this is intra, positive charge minus negative charge. This would be extracellular. This is going to give you lots of plus. So when you have these chloride ions moving here to the cell that's already been activated, it's decreasing this term, the magnitude of this term, which in turn is decreasing the voltage across the membrane, which makes it less, which doesn't make it as depolarized. All right. Question. Like, oh, you guys didn't see that. Well, you'll see it on the recording, I think. But okay, I'll repeat it one more time. So let's see what we have. I mean, no one picked this one, but anyways, this last option is saying that any negative charge over here is moving here. That wouldn't want to happen, because if you want to activate this cell, you want the membrane potential to be positive, right? So you have positive inside, intracellular, and then the difference, because it's the voltage difference. Okay, I'm just gonna not use the laser pointer so that I don't lose my work. So this is positive voltage intracellular, and then minus for the difference because the membrane potential is a voltage difference. And then you have minus charge outside. And this is voltage extracell, intracell. And so this gives you a very positive voltage difference. And this will depolarize the cell. So I was just looking at the voltage difference right there. So now if I had negative charge, if I had all these negative charges moving this way, the magnitude of this term would decrease, and that would decrease the positivity of the membrane potential, and it wouldn't really allow for depolarization. Okay, but so you would have minus charges going this way though, right? So right now you see the Na plus is coming this way. Well, there's also chloride moving that way. And so in another way, potassium is going in this way, and any negative charge you might have in the cell is going this way. So the plus going this way, minus going that way. Plus going this way, minus going that way. Was that better? Okay, all right. Maybe I can get a teaching position in McGill. Maybe. No, I mean like, yeah. Course coordinator, oh, please no. Okay, back on track. Stop this. Share screen. Two more cardio. And then 7 more endo. The endo ones aren't as bad. Now I have to say that the cardio ones, they just go up until about lecture 6 or 7. But you know, he might ask stuff about exercise. He definitely will ask stuff about exercise and orthostasis. All right. And those, and also the innervation, the sympathetic, parasympathetic. If you want to give a beta agonist to treat something, like those are the kind of thinking questions. And I hope I wasn't able to make any. I didn't have the time. I apologize. But I'm sure you can find some practice questions about those. And there will be a practice exam too. right? Yikes. Yikes, guys. Yikes. All right. Anyone, now that you see the answer, anyone want to care to explain? Go ahead. No. So mean pressure, yes, exactly. Mean pressure is diastolic blood pressure plus 1/3 pulse pressure. So to calculate mean pressure, it would be diastolic blood pressure plus 1/3 the quantity systolic minus diastolic. It would be math diastolic BP systolic BP minus diastolic BP. Yeah. Hmm. Yeah. So this one, I don't know why you guys said this one was false. Did you think I was saying like diastolic minus systolic? Yeah, I was asking false. Yeah. Really be careful. Really be careful during these questions, you know. Yeah. I would be familiar with the methods of, you know, measuring blood pressure. So, because there could be a question just like this. All right. And then I'll just quickly, for the recording, I'll just quickly show the equation. So you guys will just, I don't know what you'll see on the screen over there, but so it's mean arterial blood pressure equals diastolic blood pressure plus 1/3 pulse pressure. And so this equals diastolic blood pressure plus 1/3 systolic blood pressure minus diastolic blood pressure, right? So it's not just systolic blood pressure minus diastolic blood pressure. Is that what I'm not sure if, let's see. The method of, oh, that one's not even a question. All right, anyways. Stop sharing. All right. So we're probably gonna go over 8:30, but if you have to leave, I'm not holding you here hostage. So I suggest finding a few friends and going over the respiration question sets together. And you know what helped me a lot was explaining why each answer choice is wrong, and then why not just why one is correct, why all of them are wrong. And like what word or words would you change to make this correct? You know, it just gets to a point where you do that on the exam as well. You're gonna do very well. when I took PHGY 209. Kind of exposing myself here, but like I didn't really have many homies back when I took PHGY 209. So I didn't have like anyone to go over the questions with. And I did much better in PHGY 210 because I had people to like, oh, this one's wrong because this, and like debate with people. So I really do emphasize the usefulness of collaborative work. And you could get like, I don't know, you could book like a study room. What I did was with my friends, I booked a study room, and we would yeah, you could stay the whole day. We would draw out the the diagram, and like just from scratch. It's like randomly like spin a pencil, whoever it lands on it. Like you have to draw the whole diagram and explain it. And so okay. We're getting towards the end, so I'll just try to make it quicker. Lock, show. Yeah, so okay, this one, you can read these and be like, oh, I really don't know, but you have to know that capillaries don't have smooth muscle. I don't know. Anyone here in a NAT? You're in a NAT? Yeah, you remember NAT 261? You have a NAT. Oh, so you're not in the NAT and cell bio program. No, okay. Okay. Anyone in that program here? Damn. I'm like, I thought, yeah, small sample. Small samples aren't representative. That's a perfect example. No, but that also works too, because yeah, but yeah, so everything else was about arterioles, and then this one was about capillaries. So like how Dr. White said, which one of these is not quite like the other from Sesame Street? That also works too. But yeah, it's kind of important to know the capillaries because it's exchange. They want to be you don't want muscle around them because then it increases the thickness. There's less exchange going on. That's why they don't have smooth muscle. All right. So capillaries are exchange vessels. They don't have smooth muscle. Okay, on to endo. The 7th question of endo is, I think you guys might like that one. Once we get to 8, I'm going to stop from now on. Oh, 9. Perfect. Lock, show. Uh-oh. Yikes. Yikes. I'm just playing. It's all right. It's okay to make mistakes now. All right. Just not on the exam, please. Inhibin is a non-steroid hormone, I believe. There are positive feedback mechanisms in the male reproductive system. Upon stimulation by luteinizing hormone, it's Leydig cells. The L in luteinizing fits perfectly with Leydig, the L in Leydig, and then follicular stimulating, the S in FSH with the S in Sertoli. That's a way you can remember. But I guess this is like a line in Dr. White's slides. This is required. Okay. Of course, yes, yes. Okay. Yes, so I do mean 125D. Yeah. All right, I'm closing it. It's okay. It's okay. You meant insulin. Yeah, you meant insulin. Okay. Okay. So vitamin D. All right. Insulin is a peptide hormone. So it has a receptor on the outside of the cells. Estrogen and vitamin D are both lipophilic, kind of they're hydrophobic, so they can pass right through. Their receptors are inside the cell. They can translocate into the nucleus, cause expression of genes. And same with cortisol and thyroid hormone, right? So it is insulin that does not signal through a nuclear receptor. This one, did we talk about this today?
Yeah.
Yeah. My pleasure. Thanks for coming. Good luck on the exam. You got this. All right. Lock. Show. Yo. Okay. 100%. There we go. You got a flop so you can slay. Okay. Oh, there's a typo. Yikes. Sensitized. All right. Yeah, so oxytocin is like, I think of it as like the ejecting hormone. Like it, it's kind of vulgar, but like oxytocin causes the ejection of the baby in pregnancy. Yeah, you eject the kid, eject the milk into the kid's mouth. I mean, like now you won't forget because yeah. Yeah. Okay. Are we good here? Okay. Question 5. And we'll be done in less than 10 minutes, maybe. One more. Perfect. All right. So decent spread on this one. PTH is not involved in regulating synthesis of active vitamin D. It is. It's very important. But it's, Dr. White mentioned, in other tissues, it is PTH independent. But, you know, in the kidneys, I believe it is involved in regulating. So it stimulates synthesis of 125D or conversion into 125D. Patients with renal dysfunction are at risk of osteomalacia. So the way this one's correct, because the way I think about it, if you have messed up kidneys, the kidneys are where 25D becomes 125D. If you don't have 125, if the kidneys are messed up, you don't have as much 125D, you don't have that much calcium absorption, bones are weaker, right? So it's kind of you got to think about it step by step. Kidney stones are not a symptom of hyperparathyroidism. Well, so we know hyperparathyroidism is going to lead to higher levels of parathyroid hormone. PTH stimulates increasing blood calcium. So if you have a lot of calcium, you can have a lot of mineralization leading to kidney stones. All right. 125D is, vitamin D is 1-hydroxylated in the liver, and 25-hydroxylated in peripheral tissues such as the kidney and skin. It's flipped, right? It's 25-hydroxylated in the liver and 1-hydroxylated in different regions, including the thymus. In the skin. Yeah, like a lot of places. But yeah, bone resorption is enhanced by PTH, not calcitonin. All right. Good kidney question. I'm getting you guys ready for renal with Dr. Takano. Perfect. So this one is false because it's actually the cortex that's composed of those three layers, all right? So it goes zona F, zona G, zona R, and then medulla. So from top to bottom. So top is zona F, next up is zona G, then zona R underneath, then the medulla. Adrenal glands are heavier in males than in females. So Omar and I, we've got bigger adrenals than Brianna. I don't know your Cindy and Alexandra. Perfect. And yeah, Phil also has bigger adrenals than you guys. The cortex produces steroid hormones such as cortisol and aldosterone. It does. And okay, no one chose these. This is pretty easy. Last question. This is for all you sweaty pre-meds. Yeah, I am talking about myself. I had a blast making this one. I was just like, patient presents with. That's how it starts, man. You get the tunnel vision, the white coat. You imagining yourself with the white coat. Yeah, so say like you're around the patient, you're doing your rounds in the hospital, with the chief resident as a med student, and then one of the med students comes up with this incorrect hypothesis, and you can be like, oh, from Fiji 210, I remember this one's wrong, actually. All right, one more person, and then we'll go over this, and you guys can head home. Okay, so let's break it down as a good doctor would. The patient presents with recent but massive weight loss. That means, so okay, so you skip the step there by saying hyperthyroidism. What leads you to believe hyperthyroidism? You're right. Increase, yeah. So the basal metabolic rate has shot up. So that means, yeah, high T3, high T4. Perfect. You see that his blood has elevated concentrations of reverse T3, but low thyroid releasing hormone and thyroid stimulating hormone. So this is tertiary hypothalamus. This is secondary anterior pituitary. Okay, and they're low. But his thyroid gland is enlarged. Goiter. So you're thinking goiter. Toxic, non-toxic, we don't know yet. All right. We can reason that. Which of the following is an incorrect hypothesis? So the patient likely does not have a hypothalamic tumor. So if they had a hypothalamic tumor, then this thing would be pumping out a load of TRH. But we're saying it's low. So we're saying low TRH. So that's why this is correct. I'll go over why this one is right, like why this one is incorrect at the end. The patient may be developing a toxic goiter. That is a correct hypothesis because the thyroid gland is enlarged and the concentration of our reverse T3 is higher. Okay, so this could be a possibility. The patient may have elevated levels of LATs antibodies in their blood. So it's important to know the difference between Graves and Hashimoto's. All right. So Graves is when you have these long-acting thyroid stimulators. The antibody mimics thyroid stimulating hormone, I believe. And that causes the thyroid to secrete a lot of T3, T4, right? And so if that's the case, then the thyroid is going to be increasing the secretion of T3 and T4 and reverse T3. And these higher levels are going to cause low TRH and low TSH, but you're still going to have the problem because it's not the feedback loop is still there, but it's not really working at stopping anything. Patient may have thyroid cancer. I mean, yeah, it's enlarged, and so it's enlarged and the reverse T3 is higher. So this would be a primary cause. So the patient may have a tumor in the anterior pituitary. So this is at the secondary level. If they had a tumor in their anterior pituitary, you would see high levels of thyroid stimulating hormone, so that's why this one is incorrect, because instead of having high TSH, we have low TSH. Okay, so that about concludes everything. I'm sorry I didn't have any respiration questions, but you do have the USCA ones. I don't know, just study hard this break and go in, just I don't know. I found that treating each question separately was really, really good. Don't let one question mix up your headspace if you don't know the answer to it right away. Just reset and focus everything on that next question at hand. Really go into it. Make sure you know the difference, which of the following is incorrect, which is false, true. Delineate that one first, all right? What are you looking for? And then go through them one by one. Is this one true? No, it's not. Cross it out. Is this one true? It is. Okay, I'll keep it there. Then you have 3 more options. If you do that, you select an answer choice, and then you wipe that question from your mind, and you go on to the next one, and you restart that cycle again. All right? Yeah. But you guys being here so much before the actual exam, I got no doubt. Homies watching the recording, I'm proud of you for watching the recording. I hope it's not like hours before the exam, but I understand because I've been there before. So other than that, I mean, you guys can head out. Thank you for coming. Thank you for listening. Thank you for participating. It was a pleasure.